What do you do if you have a sty? Hi, I'm Dr. Pamela Terrio, or Dr. T, from Alleviate Dry Eye. I'm the author of the book Alleviate Dry Eye and the clinical director of the Dry Eye Center in Shreveport, Louisiana. Thanks for joining me today. Last week's blog, we talked about what is a sty and why were they so much more common when we were in our time of self-quarantine during the COVID-19 shutdown. Eye doctors across the country commented on multiple panels and blogs that that is the infection that they noticed the most from patients during the shutdown. If you missed that blog, don't worry, you can go back to my website, www.pamterrio.com/blog/64 to review what a sty is. Now, what if you have a sty? Oh my. What can you do to treat it? So number one, you want to make sure your hands are clean and you want to avoid touching your face or eyes and touching the sty. In the last blog, I also said, don't pop it. Do not try to pop the sty. It's not going to be good if you pop it. You could spread the infection, make the infection worse, make the infection deeper into the eyelid, and so on. So also if you have a sty, make sure you're keeping your face and your eyelids clean. Try not to wear any makeup, and if your eyeliner, liquid eyeliner or mascara tube is more than 3 months old, please throw it out. Ladies, these things are disposable and mascara has a shelf life of 3 months. You're rubbing it on your lashes every day, it's picking up bacteria and you're putting it back into a warm, dark tube where it can grow and flourish. And so in 3 months' time, your mascara tube is filled with bacteria. So throw that guy out and wait another week before you start using your mascara again. So you're at home and you're going to treat your sty. What are you going to do? Well, number one, you're going to do a warm compress. If you don't have one of these handy dandy, we call them brooder masks, they're a moist heat compress that you pop in the microwave for 20 to 30 seconds. Then you lay this guy over your eyes for as long as it'll stay warm, which is 8 to 12 minutes. Make sure you do the baby bottle test on the back of your wrist. Make sure it's not too hot before you place it over your delicate eyelids, but really warm compresses as many times a day as you can stand it. And then, of course, do a lid scrub. So I have my favorite right here. This is the We Love Eyes Tea Tree Foaming Lid and Lash Scrub. It comes out like a foam. I know I've showed you this, guys, before. It comes out like a foam. You just put your fingers together, a little bit of foam, and then go scrub, scrub, scrub right into your lids and lashes. Now you want to do that, of course, when you don't have any mascara on. So you use beforehand the We Love Eyes makeup remover. This happens to be one of my favorites. I have dry skin, so the oil-based makeup remover is my friend. I also really like using a makeup removing cloth, which you just run under cold water and can scrub the makeup away because this is a really tightly woven microfiber cloth. So I hope that you love those guys. If you don't have a favorite eye makeup remover, please get my guide. It tells you all of the makeup removers that you can use when you have sensitive eyes. You can get that on my website at www.pamterrio.com/makeup remover. And if you're not sure, I'll move on to that later. Okay, so that's what you do if you have a sty. Keep doing the lid scrub and the warm compresses again and again and again, as many times a day as you can stand, especially the warm compresses, until the sty opens up and a lot of white gooey stuff comes out of it. If you don't, then you're going to end up at the eye doctor's office, and in a minute I'll tell you what will happen when you come to the office. So what could you do to prevent it? So you've had a sty before, or now you're just afraid of getting a sty because I've scared you. What can you do to prevent them from happening? Number one, you've got to remove your eye makeup daily. So like I said, my favorite, We Love Eyes, oil-based eye makeup remover, oil and a makeup remover cloth. Those are my two favorites. Please get the guide, www.pamterrio.com/makeup remover. That'll get you to the guide. So if you have sensitive eyes, you'll find the right makeup remover for you. All right, number two, Remember to throw your makeup out on time. Like I said, mascara and liquid eyeliner has a shelf life of 3 months. Daily, do your eyelid scrub. So this is the tea tree oil one. It's a little bit more robust than, say, doing the AkiSoft Hypochlor, which is just a spray, and that you use, just spray it onto your lids and lashes with your eyes closed. Comes out as a spray, and then you just rub over your lids and lashes. Let this one air dry on your eyes, whereas with the foaming scrub, you do have to remove that with water afterwards. And then daily, a warm compress. This feels great. Last thing you do before you go to bed, put that on. Those are the ways to prevent styes from happening in the first place. So what if you have a stye and it doesn't get better? You've tried these at-home treatments. It's either getting worse or it's not better after a week. You do need to call your eye doctor. So if you come to the office, generally the eye doctor will give you antibiotics orally, so you'll have to swallow some antibiotics. You might get a little antibiotic cream to rub on the stye itself. If that doesn't work, then the eye doctor would either inject it with a steroid if they think the infection has died down, or actually surgically remove it. They flip the eyelid inside out and kind of scoop out the infection. So whenever a patient comes in to see me and I do put them on an antibiotic orally, I tell them to go home and do warm compresses, warm compresses, warm compresses, as many at times as you can stand, because if not, you're on your way to surgery. Unfortunately, there is no quick fix with this. The best thing to do is prevent them. If a stye comes up, it is going to be a few days to weeks before it completely resolves. Even if you were to come in and have it excise in the office, it does take a few days for it to heal and for your lid to look normal again. So the best thing to do is to prevent them in the first place, which is daily lid and lash hygiene with either the AkiSoft spray or a lid and lash scrub, like this one that We Love Eyes, and a warm compress daily. If you don't know all the rules about how to keep your eye makeup clean and where to put it on your eyes, I would love to share the best tips and tricks with you. I have a course called the Clean Makeup Manual, and you can find out all about that at www.pamterrio.com/clean makeup manual. Alrighty, thanks for joining me again today. I hope you have enjoyed this. If you have questions, please drop them in the comments below. And remember, we have to take care of our eyes today so that our vision will last us a lifetime. Thanks again for joining me, and bye for now.